Duly noted for 27/2016. Hi, I'm Dr. Kathy Dooley. I'm here in Grenada, West Indies on a teaching stint, and I wanted to talk to you today about some proper executions of a great muscle to build internal rotational hip power. A lot of people are missing internal rotation. This drill is called a windmill. The reason why a lot of people are missing internal rotation of the hip is they tend to use a pelvic tilt that's too anterior and go into their low back too much. If I go to the side, you can see what I mean. As their hip starts to internally rotate, they'll start to go into hyperextension of the low back, load their SI joints, load their hip flexors. You end up with quite a bit of discomfort through here, and then you limit your femoral position by putting yourself into that tilt. So one of the things you want to remember when you're working on internal rotational drills like the windmill is to keep your chest up and your ribs down. By keeping your chest up and your ribs down, you're keeping your thoracic spine extended at the top, and you're pulling the ribs down to make sure you don't go into the lumbar spine. So you have to prevent that hyperextension that happens. With hyperextension usually comes into your pelvic tilt. That'll lead to hip flexor tightness and basically a disruption of what you want to do with this internal rotation of the femur. The foot position, you actually want to jimmy the feet away from the hip that you're leaning into. So some people say it's a 30 and 45 degree. I think that you probably shouldn't worry about that too much. Just make sure that you are putting the majority of the weight, about 80% of it, on this leg. Okay? Some people will put a water bottle under their foot on the opposite side. I personally don't like that cue so much because it limits your ability to get tripod stability into the opposite side foot. But try to focus on trying to really push through a straightish leg on this side, not locked out knee, but definitely a straighter leg, and then a bent knee here. So basically you're working at first on this side motion that most people are missing. It's called coronal plane access. So you're working on this coronal plane, and you're letting this knee on the opposite side just bend just a little bit to encourage that. Now as you lean towards internal rotation of the hip, you actually want to push this buttock to the back upper corner of your room. And you want to do that without letting your sternum come forward and without letting your back go into hyperextension. So remember your cues: chest up, ribs down, and now you're going to go to the side and then back up to the ceiling. So this way and that way. And you're using your opposite hand to poke your hip and kind of encourage that motion. If you're having trouble with this, keep your hands between your rib cage and this bony hip prominence called the ASIS. Keep your hands there and just practice that motion. Another caveat to internal rotation of the hip is most people have too much lumbar spinal instability, and so what they'll do is they'll limit their hip motion and try to tippy into the coronal plane too much this way. That can create low back problems, so we want to actually push through here and then just naturally let yourself lean into this position. So you'll see I'm not overly using my low back, and I'm really focusing on the prime goal of this drill, which is internal hip rotation. You can see how much my hip is really, I really feel a lot of it in my lateral hip, and you're seeing my femur internally rotate. Once you got that down, you can actually reach to the sky and still pushing that hip lateral and up to the back upper wall. So you're practicing that motion. Every exercise that you do, every single rep that you do is an opportunity to make it better. Once you want to add some weight, you get pretty solid at it. You can turn your feet, and still the same rules apply. You're pushing up and back and allowing this to go forward. Don't want to tippy bird the lumbar spine or the sternum. Really push that hip backwards. It does not matter how far you go to the ground. There is no reward. I see a lot of people do, as far as a mistake, they love to tippy bird and show off how much lumbar instability they have. That limits the amount of actual hip internal rotation that you get. This is a fantastic drill for people that are suffering from too much external rotation of the hip or not enough internal rotation of the hip, the femur relative to the acetabulum of the hip. Wonderful drill, the windmill. Hopefully you'll work on it with these cues, and if you have any questions, email me at drkathydooley@gmail.com. Bye.